Good evening, everybody, and welcome to this evening's webinar on multiple myeloma. I'm Michael Barasch. We're joined this evening, and we're honored to have Dr. Betsy O'Donnell from the University of, Harvard, actually, but also works at Mass General. Also joining us, as many of you know, is Laura Mooney of the Staten Island Multiple Myeloma Support Group. We also have Liam Lynch of NICOSH. And then my partners, Dana Cohen, Dom Penson, Lee London, and James Steiner. Dr. O'Donnell, I can't thank you enough for your time. You're so generous this evening. Thank you so much. Having said that, let's go right into our video.
The first thing that I hear from the non-first responder community in Lower Manhattan is, I'm sick, but I don't deserve anything. I'm not a first responder. I just lived here. I just studied here. I just went to school here. I just raised a family here. Your presence here was an act of courage and resilience. The first responders, I'm in awe. But I also am in great awe of those who came back to a war-torn neighborhood that was clearly toxic. We knew it, but you stayed anyway, and you allowed this area to grow and to become the hub. But it's your courage and your resilience that brought this place back. So please, I urge you, access what you are owed.
Over the last decade, we have all fought very hard so that everyone has access to the health care that they need. It is very important that every community member who lived anywhere south of Houston understands that you are covered. You are part of the group of people that have guaranteed health care if you have a 9/11 related disease.
I was on my way to work when the first plane hit. I was working for Goldman Sachs. I actually worked for them for a total of 21 years. I always thought that those programs were geared for the firemen and the police officers, but I'm one of the victims of that.
So we have taken on, with all of these advocates here, the task of trying to get everyone to understand that they have rights, and it is imperative that they sign up.
One of the really surprising things about our research is that an event in 2001 can continue to have echoes 17 and 18 years later, such that it is as though never smokers are smoking 2 packs a day.
My law firm represents over 15,000 people in the 9/11 community. And the majority right now are first responders, but every single day we hear from more and more survivors because we're doing this outreach. Basically, to be entitled to compensation, you need to prove that you were below Canal Street or on the Fresh Kills landfill, either caught in the dust cloud on 9/11 or for 24 hours during the month of September 2001, or for 80 hours, which is just 2 full work weeks between 9/11 and May 30th of 2002. And you need to get 2 people to sign an affidavit attesting to the fact that I saw him. I worked next to Joe. I went to school next to Francis. That's all it takes. There's a reason why my firm takes all this so personally. I have 6 young people who work for me who have lost a parent or a spouse as a result of World Trade Center toxins. 9 people in my law firm, including me, are cancer survivors. The information you get from us is going to be compassionate, and it's our pleasure to help you.
So Dr. O'Donnell, again, welcome. Can you please share with us some insight and some news about multiple myeloma in particular?
Sure. So thank you so much for welcoming me this evening. As noted, I'm a specialist in plasma cell disorders. So that is what I'll be speaking about tonight. Plasma cell disorders are actually a broad range of diseases that range from a benign blood condition to a cancer. And so for this evening, I'm just going to be talking a little bit about both of those conditions and hopefully shedding some light on them for this group. So plasma cell dyscrasias, again, are my specialty. And what you see here are different types of blood cells. So there are many types of blood disorders and blood cancers that one can have. We've heard of leukemia and lymphoma. Multiple myeloma is probably a little bit less well known than some of these other blood cancers. And what does it actually mean? My husband always asks, he's not a medical person. It literally means multiple tumors of the bone marrow. And so this disorder comes from a type of cell called a plasma cell. It's a type of lymphocyte that's fully matured. It's like the elder statesman of cells. And it is a type of cell that produces proteins that can be measured in the blood. And this is, very important because it's something that you can test for in the blood if you're concerned that you may have this disorder. There are several disorders associated with the plasma cell. One of them is called MGUS, or monoclonal gammopathy of uncertain or unknown significance, smoldering myeloma, multiple myeloma, and something called amyloidosis. What happens, everybody has plasma cells, and it's never been more relevant than during COVID when we've heard about antibody testing. What are antibodies? So antibodies are made by the plasma cell. So when we've talked about, do you have antibody to COVID or to the vaccine? These are the cells that make those antibodies. And there are disorders of this cell where you get a clone. Everybody should have many different types of plasma cells producing what we call polyclonal, or all different proteins. When you have a disorder, though, you get a clone and it spits out the same protein, and we can measure that and distinguish it from the normal protein that should be there. A lot of people have something called MGUS that I mentioned. A much smaller number of people have the actual cancer, multiple myeloma, and an even smaller number have amyloidosis. So what is monoclonal protein? In your bone marrow, you make plasma cells. That's where you make all of your blood cells. And if you look at the picture, you see a variety of colors and shapes of cells down in the left corner. But then there's that population that's all the same. That's the clone population. And the many different color cells are producing many different colored proteins. But just like the cells themselves, the clones are producing just a clone protein. And we have tests that we can do, that your primary care doctor can do, that can detect the presence of a clone protein in your blood. And so if you have this clone protein, it doesn't work like normal antibodies. It doesn't help fight infection. In fact, it has no actual activity, and so isn't helping your immune system. And this is associated with the conditions called MGUS and multiple myeloma. And so when we think about it, there have been nice studies that were done that show that MGUS is normally present in about 3% of the population over the age of 50. So it's not uncommon that we find this, but it's actually very few, only 1% per year that typically develop multiple myeloma from this. We believe and know that all people basically progress from this benign condition to multiple myeloma, but the vast majority will not, and it remains a benign condition. There's a 1% risk of progression per year to these other diseases. Smoldering myeloma is a little bit of an in-between state where you have a higher amount of protein, and the risk of progression actually goes up to as high as 10% per year. So MGUS, it's very common. 3% of the population over the age of 50 has it, and that number goes up to the point where over 85, 7.5% of the population has MGUS. And the majority of people will not develop multiple myeloma or ever have to receive treatment for it. There are different types of proteins that can be associated with different types of cancers, and the type of immunoglobulin that you produce, that's that protein down the bottom, IgG or IgA, can be associated with different types of cancers. That's something that your primary care doctor can test for, and an oncologist could certainly test for or help you understand as well if you had one of these conditions. Multiple myeloma, I'm going to talk a little bit about what this disease is. So this is a clinical diagnosis. Just because you have MGUS or clone protein in your blood doesn't mean that you have multiple myeloma. To have multiple myeloma, that protein has to cause damage. And there's very specific type of damage that qualifies or is associated with the diagnosis of multiple myeloma. And that includes high calcium. So you see a picture of the skull, and there are black spots in that skull. Those are what are called lytic lesions, where bone is lysed or destroyed. That frees calcium. So you can see elevations in calcium in the bloodstream. If there's too much protein, this extra monoclonal protein in the blood, it can clog the kidneys, causing renal or kidney dysfunction. In your bone marrow, which is really your blood cell incubator, plasma cells should be about 1%. When you have multiple myeloma, you typically have at least 10% plasma cells that are clonal. But if that number goes even higher, it may crowd out other good cells, like your red blood cells, and cause anemia. And finally, the bone destruction, just like I mentioned in that picture, you see those black spots. Those are called lytic lesions, which are very common in multiple myeloma. So having myeloma requires both the presence of clone protein in your blood and one of these 4 distinguishing features. So who gets myeloma? What's the prevalence and incidence? The median age of diagnosis is 69. There are over 30,000 cases per year in the United States. It's the second most common blood cancer after lymphoma. Compared to things like breast cancer, lung cancer, and colon cancer, it's relatively rare. Not a lot of people have heard of it. Famous people in the news, like Tom Brokaw, for example, has multiple myeloma and has been a big advocate for our disease. And we don't really know what causes it, but we do know that there are environmental exposures, such as things like Agent Orange or organic solvents that are associated with the development of this disease. Multiple myeloma is not a curable cancer, but it is very treatable. If it's caught early, you can also limit the symptoms that I mentioned, which would certainly avoid pain or other medical complications. Our treatments are very effective. You can live a very high quality life and remain on therapy. It's treated like a chronic illness. Once you start treatment, you typically stay on treatment. Our treatments are well tolerated. They're not the classic chemotherapies that some people might think of. They're not placebo, but they don't have the significant side effects compared to other cancers. And as this is a disease of older patients, the treatments are tolerated in people of all ages. I treat people up into their 90s. And so that's just some information about multiple myeloma. I don't know if there are any questions. I'd be happy to answer them, but that's our disease.
Dr. O'Donnell, I got one question here. It's from an African American gentleman who says, am I more likely to get it than a Caucasian person?
There are data that suggests that the incidence is higher, yes.
And another question was, can I continue to live an active life?
Absolutely. Yep. The only thing that's a little bit tricky about multiple myeloma is the fact that it involves your bones. And so it depends if you have bone tumors, where those bone tumors are. Very often they affect the bones of the spine. And so if you did have those little punched out lesions like we saw, you would not want to do things that are weight bearing, for example. So that's a conversation to be had with your oncologist should you have a diagnosis of myeloma.
Dr. O'Donnell, thank you. I told you I'd let you get to your rounds. Again, thank you so much for your generous time this evening. Laura Mooney, I wanted to welcome you. Can you tell us a little bit about your support group?
Okay, I started this group back in 2013 as a result of my husband coming down with multiple myeloma. At the time, we had not heard about this disease, knew nothing about it. And so we reached out to a group in New Jersey. And as a result, they asked us, why don't you start a group in Staten Island? We didn't think there would be anybody here who would have this disease because it was so rare. But we ended up having around 36 people come to our first meeting. So we were kind of stunned at the fact that there were people in our community that were dealing with this disease and didn't know much about it. We then became connected to the International Myeloma Foundation, and they helped train us in how to run the group. The unfortunate thing is that we are seeing younger and younger patients developing this disease. We've got patients in their 30s, their 40s, their 50s. So the fact that I know they say age, but I'm seeing much younger patients now, and that's not a good thing. So we just want to be out there letting people know that we can help them, we can educate them, inspire them to live a good life, and connect them with the IMF, who has a helpline, which is wonderful. So that's what we've been doing, and it's been very rewarding and helpful for many people, and we're glad to do it. As you said, Michael, if you help one person, it's worth it.
Okay, so thank you for saying that. That is the way we feel here at this firm. Because this evening we invited all of our clients with blood cancers, and as you heard, multiple myeloma is one of the 3 most common, or I think she said the 2nd most common blood cancer. There's lymphoma and leukemia as well. We were very lucky to have Dr. Richter join us, and we're going to show a short 3-minute video of his presentation, just so that so you know that we're addressing that as well.
I really just want to take the opportunity to thank all of the first responders for their service and their dedication, and getting a little choked up listening to what John Stewart and a bunch of everyone had to say. I don't think there's a person, definitely not a person in New York, maybe not a person in the entire country that wasn't touched by what happened that day. And my corollary to what John Stewart says, get what you're owed. That includes top quality healthcare. It doesn't just mean coverage of bills to make sure you don't have to deal with a financial burden, but please make sure that you are being well taken care of, you and your loved ones. So it's really important to follow up with your regular healthcare physicians, regardless of your exposure, but specifically for 9/11 exposures, make sure you have a good view, a good follow-up with your primary care physician. To switch gears, these are kind of general schematics You start off with a general stem cell, which gives rise to different immune cells like lymphocytes, and then lymphocytes eventually become plasma cells, and when they become malignant, that's myeloma. And interestingly enough, every cell along this pathway, each one, if it becomes malignant, is a different cancer. If the stem cell becomes cancer, that's leukemia. If a B or a T lymphocyte becomes malignant, that's lymphoma. Only when the plasma cell becomes malignant is that myeloma. So when we take your blood, we want to look for all the proteins. And normally we have this whole complement of different proteins because you have all different antibodies, one to fight the flu, one to fight the shingles, one to fight diarrhea. So what we do in normal cases is we put your blood on a machine and we run an electrical current through it, and it shoots it through, and it says, all right, what kind of proteins do we see? And normally we get this good spread, what we call polyclonal, poly meaning many, that there's all different types of antibodies. You know, this one to fight one disease, and this one to fight another disease, and this one to fight another. That's the normal state. But what happens when you develop myeloma is we put your blood on the machine, run the electrical current through, but this time when we look for the proteins, we find this one group, mono meaning one group of bad proteins, and we know all of these bad proteins come from one group of bad cells in the bone marrow. And that's how we know that you have a disease or a disorder like myeloma. And we find this big spike called an M spike. And we know it comes from cells, and we correlate that. So we know when we give medicine to get rid of the bad cells and they stop making that bad protein, we can measure that in the blood and know that you're responding. How far have we come? You can see that over the last 10, 20 years, if you look prior to that in the 70s, the average outcomes were not that good. Ever since we started developing newer therapies, we're getting better and better. People are living longer and longer and longer. And I do think that the cure is within our lifetime. And again, anyone who I see now, this gentleman I saw today, 51 years old, I said, we don't have a cure today, but it is my job to keep you around until there's a cure. And I think we're getting there every day. And with that, I always like to end things with, this is not the end. It's not even the beginning of the end, but it is perhaps the end of the beginning. Thank you guys so much for listening to me ramble, and I wish you nothing but the best.
Thank you, Dr. Richter. That was great and very uplifting. All right, so let's get into the World Trade Center Health Program and the Victim Compensation Fund. For reasons that I never really understood, when Congress passed the Zadroga Health and Compensation Act, they created two distinct areas. One is below Houston Street and the Fresh Kills landfill, of course. And anybody who is in that area, including some areas of Western Brooklyn, are eligible for the health program, the free World Trade Center Health Program. And as you can see on the writing to the right, sadly, while 80% of responders have been told by their wonderful unions, hey, you should enroll in this, and they have enrolled in it, only 7% of civilians have enrolled. And the only reason is most of the 300,000 office workers, the 50,000 students and teachers, and the 25,000 downtown residents, they just don't know that they're eligible, just like the firefighters and cops. And that's why we do these webinars and this outreach, so that you will help spread the word to the civilians. Take advantage of these programs. Then there's the second area, anyone who was also south of Canal Street or at the Fresh Kills landfill are also eligible for compensation for their 9/11 certified illnesses. Pentagon also eligible, Shanksville also eligible. The time that you need to have been there is slightly different. Please feel free to call us and we'll let you know whether or not you are eligible. Liam, would you tell us a little bit, please, about NICOSH and yourself, and then tell us about the World Trade Center Health Program?
Yeah, certainly. Thank you so much, Michael. Pleasure to be here. So my name is Liam Lynch. I'm with NICOSH, New York Committee for Occupational Safety and Health. We are a small nonprofit in the New York City area. My colleagues were, right there after 9/11, helping responders get respirators, and then advocating for the passage of the Zadroga Act and ensuring that responders and survivors have, this really important healthcare and also the compensation component of this. So World Trade Center Health Program, it is for both responders and survivors. It is a monitoring and treatment program that is at no cost to the responder and survivor population. So, responders get a free annual exam. And this healthcare program is extremely unique. It is packed with healthcare professionals and physicians who are specialized in treating 9/11 illnesses. And they really understand, these physicians and these healthcare workers understand the unique circumstances and the experience of this population. And this is what really makes the program stand out. You heard it said before that this is a premier healthcare program and really worth the time to enroll, even if you do have doctors and physicians taking care of you outside of the program. And also, the 9/11 population is one that is always helping others. They're the reason that New York City, survived. And so your patient data, if you choose to, can be used for extremely valuable research that will help care for responders of future disasters and this population, moving forward. And so there's treatment for over 100 different illnesses related to 9/11 exposure. And the healthcare program covers medical tests, doctor visits, surgeries, prescription drugs. There is a pretty robust benefits counseling program. And this is not a static program. It is designed to evolve with the changing needs of its patients, of its population. And so if you join and you add more data, this data is used and this information is used to potentially add conditions to that list of covered conditions and have it be connected to 9/11 exposure so that they can, responders and survivors can get that treatment and also that compensation. The last thing, I think this is the really important piece of the program, is that early detection saves lives. There is a long latency period for the development of certain conditions. You can be exposed 20 years ago and we're 20 years out. And the development of a condition may take that long or longer to develop in the body. And so now, experts are thinking that we're going to start seeing diseases pop up in this population that are connected to asbestos exposure. And we know that there was plenty of asbestos down at the World Trade Center site. So it's an extremely important program, open to both responders and survivors. And here at NICOSH, I'm happy to help anyone enroll in the program who needs help.
All right, I'd like Lee London to address this.
Sure, I just wanted to thank everyone for joining us and really thank Laura Mooney and the International Myeloma Society. It is an amazing support group that really goes above and beyond for their members. So I just really wanted to thank them. But as I explained to everybody who has 9/11 exposure, and many people who have 9/11 exposure can't even make the connection to the cancer that they were diagnosed with. Now, multiple myeloma has a 146-day latency period. In order to say that your cancer, your blood cancer, is linked to your exposure at 9/11, and you don't just have to be there on the day of 9/11. The exposure zone is 9/11 to 9/11/2001 to May 30th of 2002. So many of our clients weren't there the day of 9/11. They went back into the zone 2 weeks later once they reopened Wall Street, and you had teachers, students, workers, survivors, residents going back into the zone, breathing the same air and toxins as first responders, and now they're becoming sick. And if somebody, was diagnosed with multiple myeloma or any type of blood cancer, in order for it to be linked to your exposure, it has to be diagnosed 146 days after 9/11 in order for it to be linked. And blood cancers have the shortest latency periods. So solid cancers have to be diagnosed after September of 2005 to be linked. But blood cancers, it's only 146 days. So a lot of members that are part of the 9/11 community don't even know that they might qualify for this because they were diagnosed so soon after 9/11, never made the connection that their cancer was caused by their exposure, and haven't made claims. And their families haven't made claims because, God forbid, somebody that could have passed away from a cancer and you knew they were there on 9/11 or the months thereafter. That's who we want to get the word out to their families.
Thank you, Lee. Okay, James, will you tell us a little bit about the deadlines that people here have to know about?
Absolutely. So historically, the law said that a person had to register with the September 11th Victim Compensation Fund from within 2 years of the date that that person was certified with a 9/11 related illness, or if that person passed away, that their family had to register a claim on their behalf within 2 years from their date of death. The problem with this is that many people, like Lee mentioned before, didn't make the connection that their illness was in fact 9/11 related, and that the cause of death was 9/11 related, or a lot of people who actually did treat at the World Trade Center Health Program didn't realize that the doctor who made the diagnosis of their condition actually certified that condition as being 9/11 related. So what that resulted in is people who technically meet the qualifications to qualify for compensation for their 9/11 related illnesses, but were unfortunately time barred from actually filing a claim. And the VCF realized how unfair this was. So the special master actually did the right thing and extended the registration deadline to July 29th of 2021, as you see on your screen here. So this deadline actually applies to anyone who was certified with a 9/11 related illness or who has passed away with a 9/11 related illness. If they have not registered yet with the September 11th Victim Compensation Fund, then they should definitely do so now to preserve their right to file a claim in the future. What's interesting is that by filing now, you are actually preserving your right to file a claim, but God forbid, if you were to pass away from a 9/11 related illness, you've also preserved your family's right to file a claim on your behalf.
Let's hear Dana. Would you please talk to us a little bit about some of the benefits of the Victim Compensation Fund Personal Injury Awards?
All right, so you've heard a good deal now about the World Trade Center Health Program, which is the program for the World Trade Center community that provides medical care. The Victim Compensation Fund is the program that provides compensation. It gives money to people who are sick, and it's there to help families and individuals who are suffering. For personal injury claims, the awards are broken down. You can think of them into two categories. There is a part of the award that will be for pain and suffering, and there is a part of the award that will be for the economic losses that the person suffers as a result of their illness. So we know that when someone is sick, they can become disabled, perhaps they can't work. The VCF recognizes that, and it will compensate people for that. So let's talk about the personal injury awards first. Those awards range, they vary depending upon the severity of the illness. The range is anywhere from $20,000 to $340,000. And one of the things that we always do is try to make sure that our clients get the higher end of the range. They get everything they're entitled to. There are things that you have to present to the Victim Compensation Fund to get the higher end of the range. It's not just enough to say to them, I have this illness. It can take more than that. As for the economic losses, the lost earnings, those awards are really based upon the age of the person at the time that they become disabled and what they were earning and would have been expected to earn had they not become sick. And those awards can be quite large. We see them sometimes in the many hundreds of thousands into the millions of dollars, depending upon who the person was and what the person did.
Dana, Dr. Richter mentioned a 59-year-old patient of his with leukemia or lymphoma. I forget which one it was, but how much work life expectancy will the Victim Compensation Fund presume that that person would have worked in calculating the economic loss award?
Right, so the Victim Compensation Fund will default to standard work life expectancies, meaning that they would anticipate that that person would have worked through age 65. Now, maybe there's something special about that person. Maybe that person had young children. Maybe that person had a mortgage that was going to be around much longer than age 65. Maybe that person had a pension that wouldn't vest until later than age 65. And in those cases, we will show the VCF that they have to deviate from their projections and award more.
Thank you so much. Dom Penson, So Dom and Dana, by the way, Dana Cohen and Dom Penson are co-managers of our law firm's family assistance team. I mentioned earlier, we lose a client every single day. It's truly heartbreaking, but it's also incredibly gratifying that we can take care of their families. Dom, would you talk a little bit about the Victim Compensation Fund death benefits and the deadlines for families to register?
Of course, thank you. There are some additional categories of compensation available in a wrongful death claim. They include, for example, money, an award to a surviving spouse, a spousal award, a direct award to any dependents of the decedent. So anybody listed on a tax return, or if not listed on the tax return, but can be proven through other means to have been a dependent of the victim, they are entitled to a direct award. Each dependent is entitled to a separate direct award. Burial costs are recoverable from the VCF. They will reimburse burial costs. And they also provide compensation for the loss to the household that the victim belonged to, for the services that the victim used to provide to the household. That has a financial value. The VCF recognizes it, and it will provide reimbursement for the loss of those services. So when you take all of these categories together, the pain and suffering, the direct award to the spouse, to the dependents, the reimbursement of burial expenses, the lost earnings, and these replacement services awards, this can add up to quite substantial money, hundreds of thousands, sometimes millions of dollars.
Dana, would you please summarize what everyone should be doing now?
Well, yeah, you can see on the slide, share this information with your support groups. You can make a difference to someone. People like Laura are doing it every day, and you can too. You never know where you will find someone who needs to know about this, so please spread the word. Don't assume that people know about it. We meet people every day who never heard of this, who didn't know they were eligible, and so spreading the word is our mission, and we hope it's yours too. Register for the World Trade Center Health Program. That's where everyone starts. That's where your condition will be certified, and that's where you will get the health care that you deserve. And register for the Victim Compensation Fund. Once you register, you've met the deadline. You won't have to worry about it. And if you're worried about whether you've missed the deadline, obviously call us. We'll tell you, we can help you. Get your proof of presence in order. You've heard a lot about the P's, the presumption, but there's another P that I want you to remember, and that's proof of presence. It's so important. It's the toughest part of these claims. It's why you have to do it now, because it's 20 years later. It's not getting any easier. We can help. There are lots of people that can help, but time is not our friend in proving that the exposure happened. Get your skin checked. It's something that's very easy to overlook, but we know how important it is. We have clients who pass away from melanoma. We don't want to see it. So please, you know you're at increased risk. Get a skin check and encourage others to do it too. And plan, because this program, if you're a part of it, or even if you're not, your family may be eligible to become a part of it one day. So get a will, get a healthcare proxy, update your beneficiaries. That's going to dictate where some of these benefits go, and make sure that your family knows that you were there and that they might be entitled to these benefits if something were to happen to you. Just thank you all for everything that you do.
That's it this evening. Liam, I want to thank you. Laura, as always, thank you. Dr. O'Donnell, Dr. Richter, to my partners out there. Good night, everybody, and call us if you need our help. It's our pleasure to represent the 9/11 community.